Hi everyone. Thanks for joining us for our third and final installment of Insurance, Benefits, and Cost. Oh my! My name is Emma Lott and I'm the Patient Engagement Specialist for third-party patients and gay parents-to-be at RMA of Connecticut. Today, the focus of our conversation is going to be about helping LGBTQ persons navigate kind of the ins and outs and maybe some of the complications of paying for fertility treatment. Joining me today is the wonderful Shaunda Brown, team lead for the Insurance and Billing Department. Shaunda, how are you doing today?
I'm great. Thank you for having me here for this final installment. I'm here to help with any tricky questions that you may have in reference to insurance.
Good. Well, I came prepared with my questions. I'm sure you're going to be an awesome help. To begin the conversation, we're going to first focus on cisgender, lesbian, bisexual, and queer single women or couples. Shaunda, do lesbian couples typically have infertility coverage?
As always, insurance coverage varies per employer in the policy, but standardly the consultations and diagnostic testing services are covered. That includes blood work, ultrasounds, and any additional possibly genetic testing that may be required.
Awesome. So maybe always call that number on the back of your card, because that's definitely what I tell our patients as well. So I'm glad that she confirmed that. So diving into fertility treatments a little bit, are IUIs or intrauterine inseminations for lesbian couples typically covered?
Once again, it varies with insurance policies, but IUIs can be considered diagnostic testing. In some cases, insurance covers IUIs as the prerequisite for IVF treatment. So yes, it can be covered.
That's great to know. What about the donor sperm that those couples would need for, those IUI procedures? Is that covered?
Standardly, donor sperm is not covered by insurance. That is a self-pay cost and service. The patients will have to contact a cryobank and purchase the sperm and have it shipped to RMA. Before they proceed with that IUI, it's also required that they have a consultation with our program social worker. That consultation is additional $270.
See, all of this is great information to know. So switching gears a little bit.
Yes.
What if one of these lesbian couples, not quite ready for treatment, they want to freeze their eggs? Is that going to be covered?
Egg freezing is standardly not covered by insurance, unfortunately. They only cover it if you have a genetic diagnosis or if you have a cancer diagnosis. But other than that, it's typically self-pay.
Got it. So if a lesbian couple needs IVF or in vitro fertilization, is that going to be covered?
It depends on their policy. Once again, coverage varies per employer and treatment plan. But IVF is standardly covered on insurance policies. With lesbian couples, it's a little tricky.
Okay.
Before they cover IVF, they like to know that you try to achieve pregnancy prior. So Blue Cross Blue Shield doesn't require any prerequisites.
That's
but
awesome.
Oxford, United Healthcare, Aetna, and Connecticut, they require that the patient has been exposed to sperm for a year before they give them coverage for IVF. And that exposure can be proceeding with the IUI treatments. That does account as a prerequisite.
So kind of one of the first step.
Correct.
That's interesting. What do you think that kind of the logic is for those insurance companies, or logic?
As far as our lesbian couples, unfortunately, the logic is that you haven't been exposed to sperm. How do you truly know that you're infertile? So they just want them to try a little bit, and then they'll give them the coverage.
Got it. Thanks for clarifying that.
Yes.
Now, for these lesbian couples, what if a situation arises where both women really want to biologically participate in the pregnancy? So one woman wants to use her eggs, but maybe her partner wants to carry and deliver the pregnancy. Is that possible? And if so, would those patients be covered?
Absolutely. RMACT offers reciprocal IVF cycles. Now, if IVF is covered on the policy, standardly, the freeze-all portion of the cycle will be covered by the insurance. That is the retrieval, the fertilization, and the cryopreservation of those embryos. Before the patients can proceed with the transfer to their partner, they have to check their policy to make sure they have coverage for surrogates. Even though they're both on the plan, since the egg was not harvested from her uterus, she is now considered a surrogate. So if surrogacy is not covered on their policy, the transfer to their partner will not be covered. If that is the case, RMA is here to help. We offer opportunity plans. We have our frozen embryo opportunity plan, which is bundled and discounted. It covers the cycle monitoring, the cycle medication, and the transfer to our partner.
It's good to know that we have those resources here at the practice.
Yes.
So let's shift gears a little bit and talk about cisgender, gay, bisexual, and queer single men or couples. So kind of these gay male couples that you and I deal with almost on a day-to-day basis. First things first, do gay male couples have infertility coverage?
Broken record. Sometimes. It depends depending on the policy and the employer. Standardly, what is covered for the gay males is the consultation with the doctor, their blood work, and a semen analysis. Specimen cryopreservation is standardly excluded for them, or services related to the egg donor or their gestational carrier.
Good to know. So again, calling the number on the back of your insurance card is a great first step.
Yeah.
What if a patient's policy states that they are covered for IVF? Can these patients access that benefit, or is that not as cut and dry?
In reference to the gay males, this is a very tricky part.
Yeah.
A lot of them will look at their policies and they'll tell them that you're covered for a number of IVF cycles, or you have, let's say, $50,000 per lifetime. But unfortunately, there's a small clause, and that coverage is only extended to female recipients. So they do not have access to that coverage unless their policy states they have coverage for egg donors and gestational carriers. Then they can utilize that IVF coverage.
Awesome. Well, that's certainly something that we need to continue to advocate for, both as individuals, as patients, and as a practice, because fertility coverage should really be universal for everyone, regardless of LGBTQ status.
Absolutely, I agree. So in reference to the gay males, when you do call your insurance to verify your IVF coverage, there's certain questions that you should ask about IVF as far as egg donors. Is her medical screening covered? Is her retrieval, her cycle monitoring, or her medication? The same thing for your gestational carrier. You should check if their medical screening is covered, their cycle monitoring, the medication, and the frozen embryo transfer is covered.
That's an awesome list of questions. And I especially know that advocating for equitable insurance coverage for LGBTQ persons is a cause that Dr. Leondaris, our medical director, is really specifically passionate about. I've heard him talk about it so many times. And if you have any questions about being your own benefits advocate within the LGBTQ community, please feel free to reach out, and we'd love to help you. I'm leaving my contact information at the end of the video. Okay, back to business. For cisgender male couples, so these gay male couples, would a patient's frozen embryo transfer to a GC be covered? I think that we just kind of touched on that a little bit.
It depends on if surrogates are covered under their policy, it will be covered, but if not, it will not be covered. There are two forward-thinking insurance companies that we work closely with, that is Progeny and UMR. They offer coverage for gay males that include egg donation as well as gestational carrier services. So that is something to look into. And as far as Progeny, don't think you cannot utilize them if you already have an insurance policy. You can utilize
the other day. This is so cool.
You can have Blue Cross Blue Shield as your primary medical policy and have Progeny as your secondary policy, specifically for infertility.
That's great.
So definitely give them a call just to see what type of benefits they may offer you.
Awesome. So another question, kind of a follow-up. If my company offers IVF benefits for females, would they maybe reimburse me if I were a gay male couple wanting to come to the practice?
You can, if you have some supporting documentation on how it can be considered discrimination and unfair because you're both in the same company paying for the same medical insurance, and you should have access to that benefit. So
question
it really,
for HR.
Yes, it's really a complex question that you should take up with your HR department.
Got it. So as we're coming to the end, kind of want to touch on another aspect of the LGBTQ community. So kind of any transgender persons. I know that every transgender patient that comes to our practice will have kind of a specialized fertility treatment plan, which includes a financial plan that's really tailored to them and the services that they're going to be accessing here. However, I do have a couple of just kind of hypothetical questions. So if someone's considering transitioning, but they haven't made that step yet, is there any coverage for, say, cryopreservation of their fertility, so freezing their eggs or their sperm before that step?
If it is a female transitioning to a male, and if IVF is standardly covered under her policy, she'll have coverage for the IVF portion. Okay. Standardly, egg freezing is not covered, so that would be a self-pay cost, but no worries. RMA offers competitive pricing for our egg freezing, depending on a lot of eggs that we are cryopreserving. The same thing applies to the male. Specimen cryopreservation is standardly not covered by insurance, so if they want to freeze their specimen before they transition, that would be a self-pay cost, and we can handle that here for them at RMA of Connecticut.
Awesome. And these are all definitely good things to think about and to keep in mind. So what if someone has already transitioned? Is there any coverage provided for fertility benefits?
If they have already transitioned, unfortunately, there's really not a lot of coverage or any coverage for them. The coverage may just be minimum as far as consultations and diagnostic testing, but not infertility treatment.
Well, that's definitely going back to kind of LGBTQ advocacy for insurance. That's a big thing.
Correct.
So thank you so much. Like, that's so much wonderful information that you've provided today. Thanks for taking the time to kind of walk through the ins and outs of this crazy insurance world.
You're very welcome. It is my pleasure. If you have any questions, feel free to contact me directly. I work in the third-party department, so I'm very versed as far as the coverage for our lesbian couples as well as our gay couples. And if you have any questions about progeny, I can give you their contact information as well.
Awesome. So you can reach me. My name is Emma at 203-290-6510, and I can also put you in touch with Shaunda. And we'd be more than happy to help you. And have a great afternoon, everyone.
Thank you. Stay cool.